Dr. Haider?
My understanding was whenever I see a lesion in the scapula, I call it as metastatic. The lesions in the scapula are usually metastatic. They're never benign. You said that SPECT CT was helpful in evaluating lesions of the scapula. Ribs, I agree, can be benign. But whenever I see a lesion in the scapula, I tend to call it as malignant rather than benign. And you said that SPECT CT helps in evaluating such lesions. Can you please elaborate on that?
In fact, there is an analogy. If patients with breast cancer, if there is an uptake in the sternum, likely metastasis. Similar analogy is patients with prostate cancer, if there is an uptake in the ischium, most likely for metastasis. So we have done a study. Once upon a time, without the hybrid imaging modalities, we used to overcall the focal uptake in the ischium as metastasis. But now, 80% of the time we are wrong. It is mostly an insertional enthesiopathy because a lot of structures go in the scapula as well as the ischium, as well as in the ribs and other places. So on hot uptake, we may overcall sometimes. So a lot of insertional enthesiopathies can have uptake on the bone scan. Because your SPECT is quite good, it will pick up all the subtle uptakes and you will not have a CT correlate based for any cortical changes. So it's most likely enthesiopathy.
Okay.
And
the second part of my question is very short. You know, you have convinced us that SPECT CT shows us more lesion than the plain radiographs. And if we consider NAV, which has the same characterization of lesion as the SPECT CT, and we agree that NAV is more sensitive than the bone scan, so I expect that the NAV will show us more lesions than the SPECT CT as well. The other part is that recently we have been looking at, you said in bone scans in the breast cancer, that usually the early scans are negative, and we are doing them just for the baseline scan to compare them with the follow-up. But the bones NAV PET CT, even in very early stages, is revealing lesions. So don't you think that this information is outdated and that we need to look into this scenario again? That maybe NAV PET would show us more bone lesions and bone metastasis even very early in the stage of the disease, maybe in stage 1 and stage 2.
I think NAF is good, but the only thing is you need to compare. If you do a SPECT on all these patients, if you do a whole body SPECT, which is possible now with your, what you call as a half-time acquisition and resolution recovery softwares, but I will be more convinced if you do a SPECT whole body, you will pick up these lesions which you have not seen on the bone scan at the early stage. It will be exactly like fluoride, I think so. Slightly, fluoride will be better because of the resolution, but we need to do SPECT first and compare with the NAF scan and to see whether the NAF is slightly better than the SPECT scan. Without that, we are not convinced yet to say fluoride will be the first line of investigation.
Thank you very much for the marathon presentation. Just a short one. What is your positioning at the center for the SPECT CT of the wrist joint of the hand?
Wrist, we have, depends on whether you do 2 wrist or 1 wrist. If you do both the wrist, we do low dose protocol. If you're doing a single wrist, we do a diagnostic one. So basically is we put in a Superman position, okay? Then we center around the carpal bones. And again, we also have a, what you call as a, not a mask, it's a plate, so that the patient will not know, because most of the challenges we feel is whatever the positioning and whatever the movement, the patient will not move this way. Patient will start with putting pressure on the table, but as the time goes, it relaxes. So therefore, there'll be a change in the position, but we have softwares for that where we can just align them. We can play with that for accurate localization, but it's still challenging if you have an old patient, you want to make them lie in a Superman position. For that, what we do is we do a short-term acquisition. We can do a SPECT for 10 minutes and do a CT for 1 minute. We get most of the adequate information. But reconstruction plays an important role in orthopedic indications. If you don't have a good positioning and reconstruction, you will again go into that same indeterminate mode.
Any other questions? Okay, I have one here. Dr. Gopinath,
Yeah.
is it justifiable to do SPECT CT as a routine practice for patients with prostate or breast cancer, even though the planar images are normal and there is no clinical symptoms.
The standard practice we do is if you see multiple lesions, it's not a problem because even if you miss 2 lesions out of 30 lesions, it's not going to make more an impact. But if it is a solitary lesion, and if you want to give a convincing whether it's benign or malignant, I think everybody should have a SPECT CT. And also patients with normal scans, because a normal planar is not a normal planar. Often we have quite a lot of evidence in patients with back pain, but by doing SPECT, you pick up more facet joint disease. So I will not say that every patient should have a SPECT CT. You have to do a whole body scan, look at it. If you're convinced it's metastasis, fine. You can go with a conventional whole body scan. But most often, the most challenges is when there is a solitary lesion. The question is whether it's benign or metastasis. It's like tossing a coin, whether you can go this side, that side. But if you want to go definitive, I think SPECT CT is must.
So you still would not use it as a routine practice?
No, not all patients will have. Because in orthopedic, all patients will have SPECT CT. In oncology patients, we review the whole body bone scan. And if you have multiple lesions, it's not that great a problem. But if you have indeterminate, if it's a spine patchy uptake, and I'm not convinced whether it's metastasis, and I want to be confirmed whether it's benign or exclude metastasis, then these patients will have SPECT CT. Sure. So, but not all patients. A selective group of patients will have SPECT CT.
Thank you. Any other questions? Okay.